my name is Ellie. I work as a registered nurse in the emergency department and I work at Hornsby Hospital. I studied Bachelor of Nursing and I graduated last year, so 2019, so I'm fresh as.
My name's Prue. I'm a new graduate registered nurse at Royal North Shore Hospital. I studied a Bachelor of Nursing and I graduated in 2019.
Read through the position description, make it your best friends. There are a lot of keywords in there that they want you to use in all of your answers. Also incorporate the core values into every single one of your answers.
Don't leave it too late. I think start now. I kept a little book and I started writing like placement experiences that I'd had in there, so I could easily access them when I was trying to think of things to say for my job interview, and that really helped me.
I prepared by doing what I said before, reading the position description and the core values, but also asking previous students, so like myself now for example, what questions I got in my interview, getting someone to ask them to me and saying it out loud. Practice out loud as much as you can. If you're just practicing in your head, when you come to say it, it will all be muddled and messed up. So make sure you're practicing with your friends as much as you can, because that's what helped me the most. And be as detailed as you can. A lot of detail.
So to prepare for my interview with New South Wales Health, I started really early. So I had a book that I was writing experiences in for it, I think maybe 3 or 4 months before the interview. And I used to practice trying to answer the style of questions with the experiences that I'd written down. Probably the biggest thing that helped though is saying it out loud. So my biggest piece of advice would be get your friends together and mock interview each other, because it honestly is the thing that's going to help you the most in that job interview.
I started in the middle of the COVID-19 pandemic, so that was pretty challenging because there were a lot of changes happening to the ward when I started. I had a lot less help from educators and other nurses because they were just so busy with making changes, so I was sort of thrown in the deep end a lot. And also, you know, being on the front line for a pandemic is pretty scary, especially when you're not very experienced. So I'm used to it now, and hopefully it stays at this lull and we get rid of it and the curve stays flat, but that was definitely probably the biggest challenge.
I think the biggest challenge in work so far has just been adjusting to full-time working life and shift work. Obviously in nursing you do morning shifts and night shifts, and I'm on 12-hour shifts, which are tiring, but I get more days off. But I think so far the biggest challenge has just been adjusting to the lifestyle change.
Because I didn't have much support or feedback from my educators and, you know, NUM and stuff, I really didn't know what my progress was like, and I didn't know how I was going. And then I had my performance review at 6 weeks, and they were like, my educators were like, how do you think you're going? And I was like, I have no idea. And then they said, you know, that they were really proud of me, that I was one of the best new grads that they'd ever had, and they wanted to have me on the team one day. So that was a massive highlight for me, just to get some reassurance after, you know, 6 weeks of going, I have no idea.
I think the biggest highlight for me is always when a patient tells you how much they appreciate what you've done. You could have the busiest, worst shift and feel like you're not on top of it at all, especially as a new grad. But as soon as someone takes the time out of their day to tell you that they think you've done a good job, especially coming from a patient, I think that's always my highlight at the end of the day.
Be prepared for sleep deprivation. Getting used to full-time work again and you know, you're constantly learning and taking things on board, and things are stressful, so just make sure that you sleep enough, eat healthy, drink loads of water, all the usual stuff that you would hear. And yeah, just don't get really worked up and really stressed. Like, they know that you're coming, they want you to ask plenty of questions, so don't feel like you're a fraud. You will feel like a fraud, But just ask lots of questions and you will be fine.
My biggest piece of advice for students about to enter the workforce is if you're not already working a job as an AIN, I strongly encourage you to go and get a job as an AIN, even just for a few months, because that experience is going to help you so much in your new grad year.
If I've learned anything from working in ED, I actually think it's kindness with a lot of patience. Being patient is a ridiculously important attribute you can have and take with you through nursing, because you have so many patients that are scared, they don't know what's going on. When a patient's in pain, a patient is hungry, or they're, disorientated, they're gonna act like they don't normally act or behave how they don't normally behave, and that can really test you, especially if you're already really busy. Be patient, take your time to explain to them what's going on, and I think that's sort of a big key thing that I've learned and that I've taken with me.
What I'm realizing as my year goes on is, I think a really important attribute is resilience. You're going to experience a lot of things all at once in your first few months as a new grad, and that's okay. You just need to be resilient, because every day is always better than the last.